Madam Secretary, will you call the roll? Sure. Good morning.
Senator Smith?
Present.
Present. Senator Gaddy? Senator Johns? Present. Senator LaFleur? Senator Lambert? Present. Senator Long? Present. Senator Marsh? Senator Smith? Present. Senator Ward? 5 members present and a quorum.
5 members and a quorum. We have no minutes to approve. Okay. We're going to start with Senate Resolution 145, and that's a request of the Department of Insurance to study insurers' coverage of diabetes-related medication, and it's a request, and that's to report annually, I believe. Senator Johns moves to pass favorable Senate Resolution 145. Without objection, Senate Resolution will be approved and reported. And next we're going to go to Representative Jenkins, 408. Is he here? Is anyone authorized to hear that bill for him?
I'm here.
Okay. Oh, I didn't see. I'm sorry.
Not a problem, sir.
You evidently weren't listening to me either.
No, I was. I was a little distracted, but I certainly was listening. Thank you, Mr. Chairman. And
When you're ready, just go right ahead.
thank you, Mr. Chairman, and members of the committee. We certainly appreciate the opportunity to be here this morning to present House Bill 408. The bill provides for payment of reimbursements by private insurers for ambulance services based upon local government fee schedules, and I'm going to discuss that a little bit more in detail in just a moment. Before we go into what the bill does, I want to clarify what the bill does not do. This bill does not set any rates, and this bill certainly does not seek to regulate the insurance industry in any way. Your local governmental bodies, such as your councils and your police bureaus, have the authority by state law to regulate ambulance services in their jurisdiction. This authority extends to and includes the setting of rates. The rates are generally set by the local governmental bodies, by ordinance or by a fee schedule, all of which is a part of the public record. So any insurer or ambulance service provider that is operating in these jurisdictions are aware of the fee schedule and the rates that have been set by the local bodies. These local entities, Mr. Chairman and members of the committee, take into account a multitude of items when negotiating and approving rates. Chief amongst that is response time. We're talking about emergency medical services. We're talking about personnel, equipment, medicines that have to be in a position to respond 24/7 and respond to any variety of different types of emergencies that may arise. They also take into consideration performance bonds, equipment swaps, and community services. Sometimes when we go to the Friday night football games, we see the ambulance that's set there in the shadows of the stadium. A lot of that is permitted through our local governmental bodies or part of the negotiations with our local governmental bodies. These local governmental bodies determine the type and level of services for their communities and what is a fair reimbursement for that level of service and for that response. Now, generally how this works is an insurer will go into a jurisdiction and they can operate by contract. This particular bill does not stop any parties from contracting with one another. They can still enter contracts or other alternative plans to deal with the setting of rates or how they want to be reimbursed. However, if we have scenarios where alternative plans or contracts are not in place, what the bill is basically asking is that both parties, be the insurer or the ambulance service provider, recognize that that a fee schedule is in place and abide by the fee schedule that has been in place, so that there will not be any reason for any kinds of disputes. That's the whole reason that we do it. Be it a privately owned insurance company or a municipally sponsored, privately owned ambulance provider, or a municipally sponsored ambulance provider, the rules are pretty much the same. For the municipal sponsored ambulance providers, they have to operate as a what we call an enterprise fund. In other words, they have to run just like a private business. They have to generate fees to pay personnel, to purchase equipment, to purchase the medicines that are needed when they get to the scene. All of those things are generally generated through the fees. So we want to be careful that we don't have a scenario where lower fees are being incurred, because that can cut down on the availability of emergency medical services. I have with me a councilman from Bossier City today who I would like to talk about somewhat what they consider when they set the rates. And the reason I've asked him to come and talk about it, Mr. Chairman and members, is because I know that there may be some concerns that jurisdictions may go out and inflate the rates if they're not compelled to enter a contract. But I wanted him to talk about that, and I'm going to follow up with some of the jurisdictions and hopefully be able to explain what they already have in place in their ordinances that they passed that would help us to know that this is not going to be something that allowed them to go in and begin to inflate the rates.
Yes, sir. David Montgomery, Jr. I'm a councilman at large for the city of Bossier City. I'm also a certified public accountant, and as Representative Jenkins said, I wanted to briefly explain how we arrive at our rates that we charge for ambulance services. We, of course, operate under generally accepted accounting principles for governmental entities, and as Representative Jenkins said, specifically to the EMS fund, it's operated in what we call an enterprise fund, which accounts for all the revenues and expenses. We don't lose money and we don't make money. But according to generally accepted accounting principles, we have to charge the rate of revenue so that it breaks even. In that set of financial statements, we're audited by a third-party independent auditor, Heard McElroy and Vestal. We also submit our financial statements, including the EMS fund, to the legislative auditor here at the state of Louisiana. And as Representative Jenkins said, all of our financial records are open to the public, which we present annually.
Good. Well, y'all have done such a good job. We don't have any questions. Mr. Representative, you said you had some further comments. Did you want to make?
Well, if there are no questions, I have no further comments, Mr. Chairman.
Good. I was hoping you'd see that. I have multiple green cards in support of the legislation. And in the interest of time, we're not going to read them all, but we certainly will enter them into the record. And we want to say how grateful we are for all of you who came in support or in opposition just to be here for the process, but thank you very much. I do have some cards in opposition, and I'd like to read those to you first. Mr. Jeff Drozda, who would like to speak, is here. Jeff, would you come on down? And Mr. David Hauer with Blue Cross Blue Shield is here in opposition, does not wish to speak. Mr. David Laverne with Blue Cross is here in opposition, does not wish to speak. Mr. Eldon Regilio is here in opposition, does not wish to speak. And Mr. Darrell Cahoon is also here in opposition, but does not wish to speak. And our Chief Fire Marshal is here this morning, Mr. Butch Browning, and he's here for information if anyone needs that information on the committee. So thank you, gentlemen, for being here. Mr. Drozda.
Thank you, Mr. Chairman, members of the committee. Jeff Drozda, Louisiana Association of Health Plans. I just want to take a quick minute to express, our opposition and concerns with the bill. I will say that we've had multiple conversations with Representative Jenkins, as well as members of the Ambulance Alliance and with folks from the Municipal Association. As of even yesterday, we met for an hour and a half trying to reach a compromise on this bill, but unfortunately, it's to no avail. So I just want to express our concerns on this, because for the first time that that we can find in statute. This is going to allow the local municipalities to set the reimbursement rates. And so this is where, we have some concerns, because this opens up a huge can of worms as we move forward, as we try to keep costs down and address the healthcare concerns both on the state and national level. With regard to contracting, I think some of this, some of the legislation and concerns from the local municipalities has come from contracting negotiations. So, once again, unfortunately, the legislature finds yourselves in contract negotiations that maybe both sides don't see eye to eye on, and so they're coming with legislation which we fully appreciate and understand, but we want to continue to work with the alliance and all the municipalities as well. And if this bill does pass, then we do also have a second concern dealing with those folks who do have contracts now. There is no incentive to stay in contract. There's no incentive to stay in network. And obviously it's a huge concern for the health plans across the state, because we need to maintain certain network adequacy across the state. I'm glad the Department of Insurance is here on probably some other bills, but network adequacy is very serious for our ability not only to be regulated, but also in terms of URAC and NCQA accreditation, which is important to us as well. So, we do have those concerns, and just want to realize that. Finally, the third point is that this may increase the probability of balanced billing, and I know that Commissioner Donlin and others have been trying to fight the issue of balanced billing, but unfortunately, this might perpetuate it just a little bit more. So it's just those concerns that we offer to the committee, and we just appreciate your time and happy to answer any questions.
I have no questions for you. Thank you, Mr. Drozda. I hope we can work out your concerns over the next few years, if it takes that long. Well, what's the pleasure of the committee? I don't have. Is there any further discussion? Sorry, Representative, do you want some more comments? Did you have more comments?
No, sir, I just come
Okay.
back to the table.
Representative Senator Gaddy. Senator Gaddy moves to report House Bill 408 favorable. Is there any objection to that motion? Without objection, thank you, Mr. Jenkins. The
Thank you,
bill is
Mr. Chairman.
passed.
Thank you, members of the committee. Thank you so much.
Thank you. We'll give them a minute to sort it. Representative Stokes, would you like to come forward? And this is House Bill 690, Representative?
Yes, I have two of them, 460 and 690. 690 is probably the easiest one. They're both easy.
Okay, wherever
One
you
of
want to
them take a
begin,
little
that's,
more time.
yeah, I see 460. Wherever you want to begin is fine.
Thank you. Thank you, Chairman. Senators, I offer this bill on behalf of women who have battled breast cancer, had bilateral mastectomy, only to be told that there will be no follow-up scans to detect recurrence of a new cancer. It's just been an interesting voyage, and I'll tell you that after you have that surgery, you are told we don't get any more scans, and then if you can find a doctor that will pay for the scans, they won't be reimbursed by all insurance policies. So this bill would require the insurance providers to cover it. But I'm finding out that there's also a problem with getting the doctors to order it, and had an interesting story just the other day when I went to the doctor myself. And after having surgery and having only 6 lymph nodes taken out, so my concern is, what if there's a grain of sand in some other little lymph node? I was told that there would be no scans. And I said, well, what if there's another little grain of sand in one of the other lymph nodes? And eventually, what that answer came down to, and it's a little shocking, but is early detection doesn't matter anymore. If you have a grain of sand, you're dead. And I don't take that, because quite frankly, we could pull that lymph node out and still do radiation, because I didn't even do radiation. But in my talks with other people, I've just been confounded by how many people pay for their own PET scans, how many people can't get scans, and women that walk around in fear that they have cancer again, and how many of these situations do we not catch? So at any rate, I don't think, unless you've got a red card up there, that there's been any opposition, which I've greatly appreciated.
Thank you. You do have an amendment. I'll offer that up if you want to tell us about that.
Yeah, you're right. Sorry about that. Forgot. Okay, so this is just an amendment for AFLAC and those kind of companies that have limited benefit health insurance. So this covers them from not being mandated to cover that treatment, which wouldn't be an ordinary course of their kind of insurance.
Good, thank you. I do have one question for you, Senator Ward.
Thank you, Mr. Chairman. Representative Stokes, I applaud your bill, and we all have watched closely what you went through, and I actually have an aunt and her daughter, a cousin, first cousin, that have recently went through this same thing, and I currently have one of my best friend's wives is going through the same thing as we speak. She's in her 3rd round of chemo. She did it last week.
Yeah.
So
It's
while
tough.
I don't know firsthand what you're going through, I've watched it very closely. So I applaud what you're doing here. And just to kind of speak to what the bill does in terms of having multiple scans, and while it's not dealing with breast cancer, I have a good friend of mine that had throat cancer, and it was removed, and the insurance was going to cover 1 scan per year. And thankfully for him, he's financially capable to do more. Mm-hmm. And so he said, doctor, I'm not comfortable with 1 a year. I'm going to do 1 every 6 months. And the doctor said, well, your insurance company's only going to cover 1. He said, well, I'm going to cover the other.
Yeah.
And the other saved his life, because it came back and it caught it early enough to where they were able to do what they needed to do, and ultimately saved his life. Had he not been able to afford the second one of the year,
Yeah.
it would have progressed too fast, and it would have not. It would have been too late for him by the time the year had passed, and the one would have been covered. So I appreciate what you're doing here, and at the appropriate time, Mr. Chairman, I'd like to move favor.
Okay.
Thank you so much.
Senator Ward does move to adopt the Amendment 3219 without objections. Without objection, that amendment is adopted. I don't have any other questions for you. And I do have a card in green, but I think it's on 690, not 480, is it?
No, this is 690.
Oh, we are on 690, okay. Yeah, okay, well, Miss Charmaine, I always have trouble pronouncing your name and your last name. Well, I thought Representative Marsh would know, but he said he's good with Charmaine. He knows that name well, so. So Miss Charmaine is here with United Way in support of the legislation. Thank you for being here. And let's see, I believe I have one more. Yes. Michael Renatz is here with the Sheriff's Association in support of the bill also, but does not wish to speak. Thank you, Mike. Okay. Senator Lambert moves to report House Bill 460 with amendments. Without objection, that's approved. 690.
Yeah, I don't know if it matters at that point. We went out of order and messed you up.
Probably doesn't. I've probably made that mistake before. That's without objection. Thank you. It'll be reported now. We'll go to the one 460. No, 690. Which one are we on? Jesus.
460.
Okay, 460.
Great, and I have a couple of, or at least one lady with me and a couple of others. Some representatives from Oshner, and I just need to find my little place. This one. Oh, heck, I'm just going to go from my memory. Yeah, just going to go from my memory. I'm bringing this bill on behalf of the Karen Stahl Foundation for people that have gone through breast cancer and might have been able to have their cancer detected earlier if a different method was used to do the diagnosis. Currently, traditional mammography is primarily utilized, and there is another service, though, called 3D mammography or tomosynthesis, which is a much longer word, so we'll go with 3D. 3D mammography has the capability to pick up a smaller tumor earlier, and especially in women that have what's called dense breast tissue. And I can speak for myself that I had a mammogram done in September, so not quite 6 months prior to finding the little cancer that I had. And if I would have known that such an animal as 3D mammography existed, I probably would have gone to a provider that had it. I had no idea that there was something out there that could do a better job of detecting, so insurance wouldn't have covered it anyway, although it's a nominal price. And this is just a far superior way to detect breast cancer. So this bill aims to have health insurers to cover that, which is usually a very small payment that they'll ask you if you want to spend an extra $40 or $50 to have 3D. I wasn't asked that, and I had no idea what a big deal it could have been, and it could have actually gotten me into treatment way before, and it might not have been such a life-altering thing if I would have caught it earlier, because it probably was there, and we couldn't find it because we didn't have the right tool. But I do have with me Ms. Karen Stahl,
Morning.
who came to me with this piece of legislation, and she also had first come to Representative Connick. And Representative Connick was gracious enough, given all the circumstances, to let me run the bill, because it was in his name originally, but you'll see him as a co-author. There's a whole slew of co-authors, I think, and I think, though, that Ms. Stahl has turned in a card and probably would like to speak.
Good morning. Thank you for hearing us today. I'm Karen Stahl. As of today, I'm a 17-year breast cancer survivor, so it's kind of nice to be here speaking about this. I can tell you from firsthand experience, just viewing the differences in the resolutions of a 2D mammogram and a 3D is so incredibly profound. Radiologists do not have to call cancer in the breast until it is a half a centimeter. That's pretty large. But 3D can detect it at 2 millimeters, something that can be hidden in your body that you will not find with a self-exam, that you will not see on a 2D, possibly for years, festering, growing, until it becomes a cancer that is so dangerous and maybe not survivable. I like to compare it to, for instance, if you were going to a cardiologist and the cardiologist would say, would you like to take this nuclear stress test that will determine the strength of your heart, or would you like the jump rope test? That's how significantly different 2D and 3D are. 3D should not be offered as an a la carte screening. It should be the standard screening. The lives that it has already saved are tremendously, the numbers are just uncountable. And I can tell you that a girlfriend of mine was diagnosed maybe 6 weeks ago using 3D with a cancer that would not have been found on a 2D mammogram. It is necessary for women to have access to this technology and not have to pay extra for what is best for their outcomes. I thank you for listening to me this morning.
Good, thank you. I have a comment or question from Senator Gary Smith.
Thank you, Mr. Chairman. Good morning. Thank you for
Morning.
being here.
Thank
and
you.
Congratulations on
Thank you.
17 years. That's wonderful.
Thank you.
Is this technology something that is readily available? I mean, it's
Correct.
newer technology, evidently, but
Correct.
is it something that is becoming fairly common?
It is, and it is
offices?
in place in many, many places, in most places. It's very often just the difference in software upgrades. It's not a different test. It's the same exact compression, only the resolution is different. For instance, if you could take a book and open it and break the binding, you could look at these tests one slice, one page at a time, and you will be able to find things you would not ordinarily find.
And that's amazing. And so the technology is just doing leaps and bounds. But so the cost is minuscule, if I'm understanding right.
Correct. It's
Especially
not
compared
that
to the
different.
savings. I
And
mean-
we're talking maybe $50, $75 difference in a copay, but a lot of women can't afford that because they have groceries to buy or they have to make
Right.
a decision in a budget. They'll
That-
forego
that-
what is better for them when it isn't necessary. The technology is there and they should have access to it.
Okay, yeah, that's something. I mean, the amount of savings in treatments, the amount of savings in
Correct.
lives is just for that can be a lot of money for somebody, but
Correct.
in
And
the
on
grand
forefront,
scheme
correct.
of an insurance company, I just, for the life of me, was listening to Senator Ward's example earlier. It just bewilders me that they find that they wouldn't offer these things up without us having to come here
It is
and do this
mind-boggling.
because of the tremendous, look, it's a financial issue, but the tremendous savings to them over a $50 exam where they could save thousands and thousands and thousands of dollars by catching this early.
Billions
you
in the
know.
chemotherapy industry and radiation, billions. And there isn't anyone in this room that has not been affected by breast cancer in some way. And this is such a wonderful means of early detection where a lot of the sufferers would not experience the tortures of chemotherapy and radiation. Their whole cancer experience might be one afternoon with a simple needle biopsy, removing the cancer before it's even staged.
That's amazing. That's what I wanted to make sure this technology was
Yes.
was something that wasn't just a very specific and unavailable technology, but that it is
It's
truly
very
readily
available.
and out there. So great.
Dr. Stephen Rose of Houston did his study. In fact, you can read his article in the June 14 issue of JAMA and all of his findings. It's incredibly profound.
Well, thank you. Thank you
Thank
for
you
being
so
here
much.
today. Thank
Appreciate
you
it.
for what you're doing, Representative Stokes.
Thank you.
Senator Morris for a question.
Thank you. Representative Stokes, I don't want to throw cold water. I have a wife and a daughter and a granddaughter, so I certainly support this legislation. But over the years, we have always exempted Office of Group Benefits from issues like this. And I'm not sure what happened on the previous bill, but there was no fiscal note. But I don't know if you've seen the fiscal note on this one, and it's duly referred to finance. And you know what happens to bills in finance. So I would be concerned that possibly we should look at exempting the Office of State Group Benefits from this, although that exempts a lot of women. But in many cases, what we've seen with state group benefits is they have gone ahead and provided these services without being legislatively required to. That's your choice, and we can work with that between here and the floor. But you know this bill is going to go to finance because
You're right,
here's the
and I
fiscal
didn't think
note,
about it,
and
yeah.
you know, and it's all based on state group benefits. And in many cases in the past, we have exempted state group benefits from these type of mandate
Which
coverage.
is so sad.
So, you know,
But-
you might need to think about that or talk more to the fiscal office, but it just needed you to know that because, you know, you know what happens to these
Yeah.
bills in finance.
So, Senator, do you think, I hate to do that because I hate to say to the women that have given their
That's-
work service to the
That's a
state.
problem for me too.
I know.
But I just need you to, we need to understand that. That's what's,
Right.
I mean, there is no way around that.
Right. So
it-
what
it-
you,
it-
I'm
You
sorry.
exempt them as we have in the past,
Right.
or you take your chances in finance.
Right. So what I see, and I just want to make sure, because what I have in front of me is engrossed, and we're still on an engrossed fiscal note. There's no re-engrossed, but it's coming out to 358,000. Is that what I'm seeing?
And we have the re-engrossed that shows,
Yeah.
358, and then
358.
804 over,
By
I guess that's by
23.
2023.
Yeah. I hear you.
And,
I
and,
know.
that's something that we don't have to do today. We
Yeah.
can do that between now and the floor.
Right.
And that, if we did it on
Right.
the floor, if that's what and I don't want to make that decision for you or for the ladies that are here testifying or that support this, but I think it's something you need to put your hands around before we
Right.
move on. And
Right.
we certainly can move it out of here, but it is going to be dual referred.
I think my gut tells me I'm going to go ahead and go to Senate Finance, and then if I can't get through them, then I'll try to do the amendment.
That's something that I've done myself.
Yeah, I'm going to take a shot on it. Just take a shot with it.
I just wanted you to know. I said I didn't want
Yeah.
to throw cold water, but I know you have people
Right.
here testifying today and people
Right.
that are listening. This is very important. But I didn't want to say, well, what happened to that bill?
Yeah, and I think, I've met so many wonderful women that work for our state that have gone down this same road. So I think I'm going to I really appreciate that.
I don't think there's anyone from group benefits here today. I don't see, but it might be worth your while to have a visit
Yeah.
with group benefits and see what their position might be on whether they could offer this without the legislation. They have
Right.
done that in the past.
That's a good idea too. Okay, so I will look into that. I really appreciate Senator Morris. That was wisdom.
For me.
Yes, from you.
Let's don't go too far.
Don't let it get out.
I have no more questions for you. Ma'am, did you have some comments?
I'm just here to support.
Okay,
I'm
good.
Part of the
Well,
foundation.
Good, thank you. Mr. Pro Tempore moves to report House Bill 460 favorable. Is there any further discussion? Thank you, Ms. Stokes, for that bill,
Thank you so much.
and that will be
So
moved
much.
favorable.
Thank you, senators. Enjoy the rest of your day.
Thank you. I'd like to go to the chairman of House Insurance next. I didn't see him sitting over there. He was obstructed by that chair.
Oh, I got you. I'm sorry.
Welcome, Chairman Talbot. You want to start with 824?
Sure. Thank you, Mr. Chairman. Thank you, Senators. This is a bill that, if you recall, I had a bill last year that dealt with notifying patients about balance billing, and there were some unintended consequences where they were giving this disclosure form every single time they came to the doctor. So we worked with the hospitals and all parties involved, and so what this is going to do, we're just going to notify them when they get notified of the HIPAA requirements. So it had no opposition. I'd be happy to answer any questions if you have any.
Okay. I don't have any questions right now. I do have a number of people here in support. Ms. Maxine Cormier with the Louisiana Hospital Association is here in support, not wishing to speak. Cindy Bishop with the Louisiana Orthopedic Association is here, not wishing to speak, but in support. Greg Waddell, Vice President of Legal, Government, and Regulatory Affairs, Louisiana Hospital Association, not wishing to speak. And Ms. Billy Yelverton, Louisiana Academy of Family Physicians, is here but not wishing to speak. All of those folks are in support. Thank you for being here. I do have one question now. Senator Gary Smith.
Thank you, Mr. Chairman. Representative Talbot, I like what you're doing here. You know, we talk about balance
Yeah.
billing and everything so much in this committee, and it's a problem that we continue to wrestle with. And one of the biggest things is notice to the customer, notice
Right.
to the insured there that they're shocked that they didn't
Right.
even know. They just thought it was covered. I don't see anything in here about size of the sign or how. Or
It's
are they
a
going to
form.
hand it to every patient? Or because it just says shall publicly post a notice to every patient. So when it says post a notice, it makes me think it's on the outside the building. But then it says to every patient. I didn't know if they were handing them
They're handing them
a letter. So I
Right.
I wanted to just
the
kind of
existing
clarify.
law. They'll sign a form saying that they received the notification. This is just the timing of that notification. We didn't intend it to where every single time they went to the hospital or the doctor's office they would get this notification. Really, I intended it to when you go in for a surgery or when you go in for an instance where you might be balance billed.
Good.
All right. Well, that's good.
Good, good news.
We were prepared for that.
We were
right?
prepared.
We figured
I feel
27th
safer
floor.
already.
We're on the basement.
Right. So yeah. So it's we're not changing the form or anything on it. So. I never heard the alarm in the first place.
Nor do we know Joe.
Right.
But, so you're going to give this to them upon that first.
Yeah, it
First,
coincides when they give
I-
them some
it-
HIPAA notification. So
It's important, I think.
It is.
I'd like section 2 on page 2 to be bolded. Even. I mean, we want to make sure these individuals understand. Just like you,
Yeah.
they're at an alternative facility.
And-
It's just people don't understand their insurance or how the billing goes.
Right.
Nearly enough. It's complicated, and
It is.
they go to their doctor. The doctor prescribes them to go over to the physical therapist. They figure it's all in the same
network.
and then it comes to find out that no, there wasn't actually an agreement there, and their network pays X, and the
Right.
therapist actually charged Y, and
Right.
and they're left with the balance.
It's kind of my ongoing quest to solve the balance building problem. The next bill I'm doing
Yeah.
deals with it as well, and then some more legislation I'll bring next year. So it's kind of my ongoing quest
Okay.
to try to solve this problem. But I appreciate your comments.
Well, that's what I just had. I wanted to clarify for myself
Okay.
what it was. All right, move favorable, Mr. Chairman, at appropriate
Okay.
time.
Thank
I
you.
have no further questions. Is there any further discussion? Senator Gary Smith moves to report House Bill 824 favorable. Is there any objection? Without objections, that bill will be reported. And Chairman, if you just give me 1 second.
Sure.
There's a big group of police jurors here I'd like to welcome.
Sure.
Some from my district. I see Carlos back there and others, but stand up and let us welcome you here if you don't mind, all the police jurors. Okay. Senator Marsh.
Thank you, Mr. Chairman. I also like to recognize the police jurors. They stood up, but they're from my district, from Jeff Davis Parish, Bill LeBeau, Donald Woods, and Kirk Guillory. We appreciate you being here, present at the jury. I don't see John. He must be behind the table. John Marceau, if you're there. He's behind the pole. Thank you all for being here. We appreciate it.
Senator Long.
Mr. Chairman, I'd be remiss to tell you that from the parish that started the Longs, Wynn Parish, we've got some great people here. Thank y'all for being with us today. Thank you.
All right. Chairman Talbot, you ready?
Yes, sir.
875?
Yes, sir. So this is another bill kind of dealing with balance billing. This deals with the provider networks that the insurance companies have with the doctors. We want to make sure that they're getting that information quickly. In my disclosure form in the previous bill, you would get a notification saying, you can look up and see what anesthesiologists are going to be in your group and in your network. This bill just put some penalties in there for not providing that information, makes them give that information more accurately and more quickly. So, you're only as good as the information you have. So if I go in for a surgery, I get this disclosure form, and I say, all right, I'm going to call East Jefferson Hospital and see if which anesthesiologists are in my network. We want to make sure those directories are kept as updated as possible. So that's what this bill deals with. I worked with all sides, and we didn't have any opposition, and be happy to answer any questions.
Good. I have no questions for you. I do have some cards in support. Mrs. Billy E. Elverton with the Louisiana Academy of Family Physician. And all of these are there in support, but they're not wishing to speak. Mr. Jeff Albright, Independent Insurance Agent. Mr. Greg Waddell with Louisiana Hospital Association. Ron L. Nolan with HAFA. Jennifer Murazak with Louisiana State Medical Society. Lauren Bailey with the Louisiana State Medical Society. Cindy Bishop with the Louisiana Orthopedic Association, and Maxine Cormier with Louisiana Hospital Association. Senator Marsh moves to report 875 favorable. Is there any further discussion? Is there any objection? Without objection, that'll be reported.
Thank you.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Thank you, Senators.
And Mike, you want to come on down? When you're ready, Representative Huval.
As soon as I see it. Thank you, Mr. Chairman. This is a very much consumer-friendly bill. Basically, what this bill does is when you're pricing your insurance, you want to see if you can get a better price. The insurance companies want to run what's called an MVR, motor vehicle report, to see what your driving record shows. So you go to Company A on Monday, they run a motor vehicle record. It shows that certain things are there. Well, you go to Company B will want to charge you again. Well, the motor vehicle report was just run 2 days before. This bill basically says that it's good for, I believe, 15 days, so that you don't have to be charged again for a motor vehicle report. Basically, that's what this bill does.
Okay. Senator Marsh.
So, Mike, the report becomes the possession of the insured?
Right, you've paid for it. You go to Company A, they're going to charge you for it.
So the agent gives it to you?
Yes.
So you have it in your possession?
Right, so you go to Company B, they want to charge you again. Nope, I paid for this already. It shows my driving record.
Okay.
Okay, I have no more questions for you, but I do have 2 cards here in support and wish to speak. Jeff, did you want to go first?
No, sir.
Okay. And would not like to speak. I'm sorry, Jeff. Read the wrong thing. And Jody?
Hi. Good morning. Jody Boudreau with the Professional Insurance Agents. And I just want to thank Representative Huval for bringing this bill to you. Our agents saw this as an easy way to reduce some of the costs related to purchasing an auto policy. And we know we're all wanting to do that right now. We don't know of any opposition to this bill, so we just would request that you pass it favorably, and we appreciate your consideration.
Well, I think that was the motion that Senator Lambert was going to make, to report 752, no, yes, 752 favorable. Is there any further discussion? Without objection, 752 is reported favorable. Thank you, Mike.
Thank you, Mr. Chairman. Thank you, members.
Representative Davis, you ready?
Somebody doing Dwight's bill?
Yeah. When you're ready, Representative.
Sure. Thank you, Mr. Chairman. Thank you, members. House Bill 775, in 2010, the legislature passed a law that allowed physicians who billed under group ID numbers the ability to bill for covered services provided during the credentialing phase of their term with the group ID number. So House Bill 775 just seeks to make this uniform, and in the law before it said physicians. We're just changing that to providers so that nurse practitioners, dentists, other healthcare providers can bill while they are being credentialed.
Okay, I have no questions for you, but I do have cards in support for you. All are here but not wishing to speak. Ms. Maxine Cormier, Louisiana Hospital Association, Cindy Bishop, Louisiana Orthopedic Association, Nick Waltz, Louisiana Primary Care Association, Berkeley Durbin, with Medicine Louisiana, and Greg Waddell with Louisiana Hospital Association, Jeff Albright, Independent Insurance Agents, Eddie Lau, Louisiana chapter of the American Academy of Pediatrics, and Billy Elverton with the Louisiana Academy of Family Physicians. Have no further discussion, no more questions. Senator Rick Ward moves to report House Bill 775 favorable. Is there any objection? Without objection, that bill will be reported favorable. Thank you,
Thank you,
Ms.
Mr. Chairman.
Davis.
Jeff Davis guys are here.
Okay. Representative Mark Abraham is not here, but I believe Mr. Gary Bennett, you're going to handle that one for Mr. Abraham. That'd be House Bill 757.
Thank you, Mr. Chairman, members. Gary Bennett, Assistant Director, Louisiana Sheriff's Association. The bill today is a local bill. It's for the Jefferson Parish Sheriff's Office. You've had several of these bills before, and what it does,
Hey,
it actually...
Mr. Bennett.
Mr. Bennett.
Yes, sir.
As for the Jefferson Davis Parish Sheriff's
Excuse
Office.
me, I'm
not
sorry,
the
Jefferson Davis
There's a
Parish.
huge difference.
I'm sorry. Yes, sir. Yes, sir. What it does, it requires the 15 years of service to be eligible for the retiree benefits, to be all of that time to be with the sheriff's office in Jefferson Davis Parish.
Good correction. Did you want to speak? Senator Marsh.
And those, the funds are not, is that on? It's not on.
I'm sorry.
The funds come out of the sheriff's funds, right?
Yes, sir, and this would be effective for anyone hired after July 1 of 18.
But it
does
has to
not-
come out of his operating budget.
Yes, sir.
There's no state
No, sir.
money.
No, sir.
Move favorable.
Okay, I have two cards in support but not wishing to speak. Mr. Michael Ranazza with the Louisiana Sheriff's Association, Ms. Shannon Diamond with the Louisiana Sheriff's Association. Thank you for being here. Senator Marsh has moved to report House Bill 757 favorably. Is there any further discussion? Without objection, House Bill 757 is reported favorably. Thank you, Mr. Bennett.
Thank you, members.
I think that brings us to Representative Dwight, and let's see who's here to help him with that. Ms. Laborde? Yeah.
Good morning, Mr. Chairman and
Good
members.
morning.
Stephanie Laborde, I'm General Counsel for the Louisiana Insurance Guarantee Association. House Bill 756 is curative legislation. It fixes Senate Bill 184, which was enacted as Act 166 last year by Senator Luno. Senator Luno's bill was intended to allow a claimant to collect from both LIGA and from his own insurance in the event of an insurer insolvency, rather than allowing LIGA to take credit for the insurance and to get out because of the credit in the LIGA law for other available insurance. But the problem with Senator Luno's bill is that if the claimant had health insurance or workers' comp insurance or any other available insurance, LIGA would still be able to get out even without taking credit for the insurance because of the other insurance that was available. So what this bill does is eliminate the credit for any other available insurance against the policy limits. and only allows the credit to be taken against the LIGA cap or the amount of the judgment or settlement. In addition to that, what this does is eliminate an amendment to the bill that was added on the House floor by Representative Seabaugh that would have unintentionally, Representative Seabaugh did not realize that that would have required LIGA to pay first before the solvent insurer. If LIGA were in on behalf of the insolvent liability insurer. Both Senator Luno and Representative Seabaugh are supportive of this legislation, and the Department of Insurance is in favor of the legislation, as is LIGA. I'm aware of no opposition. As I mentioned, this is a fix.
Okay, thank you. I have no, yes, I do. Senator Lambert.
I know I was involved with Senator Luno last year with this bill because, I mean, there was some real inequities happening because people who were paying uninsured motorist coverage and then the liability coverage either was exhausted or their own went under and they were out of state and they were not able to collect even though they've been paying policies. I'm not sure that I'm following you on this as to why we have to do this.
You will remember, Senator Lambert, when we met with you and Senator Luno last year, Mr. Wells and I were trying to explain to you even back then that the bill as introduced would not have solved the problem in the cases in which you were involved in, because in his case, his claimants had workers' comp, and in your case, your claimants had health insurance. And
well, mine didn't have anything. They had Medicare, I guess you'd say.
And LIGA gets credit for Medicare.
Right.
And
but their
Medicare.
claim exceeded way over the amounts.
Correct, but the insolvent insurer policy had 1530 limits, and their Medicare claims exceeded the $15,000, and so LIGA would have gotten out for the $15,000 paid by Medicare, and LIGA would have paid nothing toward their claim, and even though they had and so so Senator Luno's bill would not have solved the problem in that case, and that's what we were trying to explain last year. But what this bill does is say that LIGA will no longer take the credit against the $15,000 policy limit. What we will do in that case is we will go behind the other available insurance, and as long as their claim exceeds all other available insurance, LIGA will still pay behind all other available insurance up to the LIGA claim limit, which is currently $500,000, or up to the amount of the judgment or settlement. So LIGA just goes to the end of the line instead of getting a credit against the policy limit.
All right, they go to the end of the line, but does that solve the situation where the person's paying uninsured motorist coverage and they don't get to be able to collect their uninsured motorist coverage?
It does. They will get their uninsured motorist coverage, they will get their health insurance, they will get all their other available insurance, and assuming their claim is big enough, LIGA will pay, they will reach their LIGA coverage, because all LIGA does is go behind other available insurance rather than getting knocked out by other available insurance.
All right, well, let's assume that we have someone who has a $15,000 policy and the primary tortfeasor went insolvent or their own went insolvent. They have $100,000 in medical bills, and Medicare has paid those bills. Will they be able to collect their $15,000 in benefits?
Assuming their claim is bigger than that, which it obviously would be if they have $100,000 in bills. Medicare would pay $100,000 in bills. Their would pay $15,000, and then LIGA would get a credit for $115,000 that was paid, and we would pay the claim in excess of $115,000.
So they would be able to collect for their pain and suffering at least.
Up to $500. Up to the policy
limits of the
limit. Correct.
All right, because I want to make sure these people who are paying insurance premiums and their insurance company goes out of business, that they are still able to collect under this.
That's
Because
correct.
LIGA before was telling these people, even though you paid, tough luck, we get a credit.
And that's what the bill previously provided. And under Senator Luno's fix, all it did was say we couldn't take a credit for but we still got a credit for every other available insurance.
Well, if you couldn't take a credit for that means I got my UM.
You got your but you wouldn't get LIGA if you had other available insurance.
Well, you're not getting LIGA anyway because those bills are paid directly to the healthcare provider, right?
Correct. But LIGA would get a credit for other available insurance. What this bill does is accomplish what Senator Luno's bill, in my opinion, was intended to do, and what we discussed in Senator Luno's office last year was to make sure that the claimant got their health insurance, their insurance, and if their claim was big enough, LIGA would still pay at the end of the line.
When you say they pay at the end of the line, who they paying?
They're paying the claimant.
Okay, well, the claimant's getting it because of the coverage, not because of additional health care coverage. The claimant doesn't get additional health care coverage.
They're getting their claim paid. They're getting
Right. I mean, that's why I'm having trouble figuring out why this affects their claim, unless I'm missing something, Mr. Commissioner.
If I may, Mr. Chairman and members of the committee, I think what y'all are not communicating on is what Ms. Laborde is saying is they get both. If they have a large
Correct.
enough claim, they get both.
That's right.
They get their first, and then if they have a large enough claim, LIGA comes in behind their and behind all other available insurance and pays as well, which, as she said in her opening remarks, made the comment that Senator Luno and Representative Seabaugh, from different philosophical perspectives, are both in support of this, which accomplishes what Senator Luno set out to do last year.
All right. I just want to make sure the people who are paying premiums and
Get the full credit of what they paid for.
Yeah, if they were taking,
absolutely,
being sensible enough to pay for uninsured motorist coverage, and then they lost the company went out of business, they still get to collect.
Yes, sir.
Okay.
This bill does what Senator Luno's bill did last year and even more.
All right. As long as that's the legislative intent.
Yes.
Senator Ward.
Just quickly, how does this or does this apply in any way with workers' comp?
It does not change the way workers' comp claims are paid by LIGA. Workers' comp claims are paid by LIGA differently than by other insurers because, as you know, workers' comp insurers can claw back or get back from other insurers any other insurance that is paid to the claimant that workers' comp already paid. But that reimbursement claim would be a subrogation claim by the workers' comp insurer, and subrogation claims are defined not to be a covered claim under LIGA. So LIGA would not pay the workers' comp insurer their subrogation claim, but that's not affected by this bill. That's the case today, and that would be the case after this bill. So the claimant would be whole, and the claimant would get his and the workers' comp insurer would not be able to take that away from him.
Okay. Thank you.
Okay, I have no more questions. I do have a couple of people here in support. Ms. Jody Boudreau with PIA and does not wish to speak, and Mr. E.L. Bubba Henry with State Farm. He does not wish to speak. Thank you for being here, gentlemen. Commissioner, did you have anything else? Okay. All right. I have no more questions with on House Bill 756. Senator Marsh moves to report House Bill 756 favorable. Is there any further discussion? Is there any objection? Without objection, House Bill 756 will be reported favorable. Thank you, Ms.
Mr. Chairman and members.
Yes, ma'am. Okay. Senator Gary Smith.
Thank you, Mr. Chairman. We got the opportunity to welcome some of the police jury members from other parishes here, and I'm proud to say I have some from my parish here as well that just walked in from St. Charles Parish, Julia Perrier and Marilyn Bullock, and then Darren Dewey representing the administration. So thank you, all of you, for what you do on the local level. We know how tedious it can be, and we appreciate your service day in and day out over there. So again, thank you, and thank you for coming to join us up here at the Sausage Factory.
Yes, welcome. Well, that brings us down to Senate Bill 216, Senator Milkovich. And we've scheduled the bill 5 times, and 5 times there's no one present to present the bill. So Senator Marsh has moved to defer Senate Bill 216 without objection. That bill is deferred, and we may not have another called meeting this session, so it's deferred for sure. But thank you all for being here, and particularly those groups that came to visit today. We welcome you, and welcome to the Capitol, and we're glad to see you. Thank you very much. We're adjourned.
Thank you.